Hi everybody, we're here with Kyle Mercer doing coaching sessions, video coaching sessions. And Kyle, this question is from someone that has severe pain for the last 3 months and thought it was a physical injury and now is starting to think that it's an emotional issue and wants to know how can they know that it's an emotional issue, and if so, how do they know what the issue is?
Yeah, this is a really important question. Almost all chronic physical issues have some tie-in to an emotional issue on some level. And so it's really important to recognize the connection between our mind, our spirit, and our body, and how they're all interrelated. And I think you're right on the track of looking into the emotional issue underlying it. It can also be a coping mechanism. And that may be surprising, but sometimes we use physical issues or have physical diseases as a coping mechanism from our childhood to deal with other things. So, you know, the first or the deepest layer of work is really to say, why would I need a coping mechanism of, physical chronic pain or other physical issues, depending, for other people that have other physical issues. So there's almost always an underlying emotional aspect. Probably the first way for you to get to the bottom of this is to ask yourself, what would be the payoff that you're receiving from the physical pain? How are you getting something out of that? And that may not be obvious right there on the surface. You may say, well, I don't get anything out of physical pain. But I would suspect that if you look deeply into it, that there's some payoff or some benefit that you're getting out of that physical pain. So the first thing to do is to identify whatever payoffs we may be carrying, because that's going to lock it in and make it really hard to heal it or to recover from it if we're getting some kind of psychological or emotional payoff from it. Then the second layer, of course, is to go underneath and say, well, if the physical or emotional pain or the physical pain is a coping mechanism for some kind of emotional pain underlying it, then we have to really look in. And we do that, somatically. That one is going to be one of the ones that's really hard for you to look at personally, is really to have a catalyst or somebody that can hold space for you, create an environment for you to kind of set all your assumptions and belief behind so that you can get to the bottom of it. When it starts showing up physically, it's so buried. It's so buried in our psyche and in our spirit that we can't find it anymore. And we really need some help and support to look for that, find that. Thanks for your question.